Hi, everybody. It's Shirley Gutkowski, and I am here in St. Louis today for the final day of my sleep conference. There are, I don't know, about 20 people here. So it's a nice small conference. But we are talking all about sleep and taking deep dives into the physiology of sleep. And that means what it is that your body's doing that allows you to sleep well or not well. What are you missing in your diet? What are the missing nutritional pieces that you need to have? And I just keep going back and back and back. And I'm like, had you done this when you were an infant? Had this happened when you were an infant? Had that happened when you were an infant? Had this other thing happened while your mother was pregnant with you? So this book, my little book, it finally came. I don't know if I even showed it yet on this platform, but here it is. More Than a Kissing Spot. And it is about how the face forms to allow for really good health. If your mouth isn't working, a lot of things just can't happen. For instance, the innate immune system was our topic yesterday afternoon, so it's kind of fresh in my mind. And the difference between the innate immune system and the adaptive immune system. So the innate immune system is all about the borders and the barriers that we have for barriers from infections, bacteria that are in the air, that are in our food, all of that kind of thing. So, what we have with good facial development is the ability for the tongue to have a spot or the tongue to have enough room between the teeth and that the lips are together because this craniofacial respiratory complex here is in charge of the air and the food that we eat. So the air is filled with all kinds of problematic bacteria, right? There's a difference between the bacteria that belong in us and on us, and there is the bacteria that comes from other people and other things. So exposing ourselves, I'm a big advocate for exposing yourself to all kinds of bacteria and limiting hand washing to times when your hands are really just dirty or if you're actually working with something gross. And so those kind of things, I think it's important for kids to be able to be exposed. But the face is where all of that stuff can enter, right? So we have the nose as an entry point, and we have the oral cavity as an entry point. When you're breathing with your mouth closed, your lips together, your tongue on the roof of your mouth, and your teeth almost touching, it's harder for bacteria to get into your lungs. The nose is set up so that it has a long gauntlet of different things that happen to the air before it gets to your lungs. It has to pass through the turbinates, which are little stirring pads, I guess, inside the nose that are covered with cells that make mucus, which traps bacteria and dirt. And they have cells that create a nitric oxide. So, nitric oxide, not laughing gas, that's nitrous, nitric oxide kills bacteria. And when that bacteria is killed, it's into a bunch of little smithereen pieces. I love the word smithereen. Um, and they get trapped then by the adenoids. And if the particles are small, having been exploded, then the adenoids can take them up, no problem. It's when they're gigantic that the problem occurs. So then when you have these larger molecules, the adenoids do have to swell. There are other reasons besides that too, but this piece could be the leading part of why the adenoids get large. Same with the tonsils. So whatever makes it past the adenoids, I call it like a sponge back here before the turn. So when you're breathing in through your nose and then you make a turn, it goes down into your pharyngeal airway, right? Your throat airway, and then down into your lungs. And those adenoids are kind of like a sponge to suck up all of the different particles that have been destroyed by the gauntlets so far. And then it goes past your tonsils, and then it goes finally into your lungs, where it also has some cleaning functions. So that is how things are supposed to work. If the mouth is open, for whatever reason, usually it's in infancy, it's having something to do with allergens in the air where the mouth is open, or that generationally the mouth is already smaller than the tongue. And then the mouth is going to hang open or hang open. And in so doing, listen to me, I sound like a textbook. In so doing, the the airway is exposed then to wide open air. So the barrier is not there. So those are the biggest reasons at this lecture or at this live that the airway or that the mouth is part of the innate air, the inert immune system. Sorry, the innate immune system. I'm stumbling because I only had my first cup of coffee. You can hear that I still have my morning voice. I haven't really used it yet today. This is the first time I'm using my voice today. So I'm a little bit croaky still. I had a cold last week, and keeping my mouth shut and using the Buteyko nose clearing technique has really made a difference in the amount of Kleenex that I had to use, or puffs. Puffs are my choice. And I have been pretty snotty, and it's been working its way out. I can go the whole day. I went the whole day yesterday without having to blow my nose, but this morning it was a little bit mucusy. I know that's really all the things that you wanted to know, but I really want to illustrate again how important it is that the baby's mouth is forming correctly. There are a number of dentists at this meeting, and all of them have children that have airway problems, even dentists. And they're very young women dentists. I don't know that they're not 40 for sure. They might be 31-ish in that age range. And their kids are struggling. Their children already have had arch expansion. They've already had to have tongue tie releases. They are going through myofunctional therapy. And as a dentist, it's expensive enough to have to do all of those things. But as a regular person, it can get very, very, very expensive to treat this problem. And it is the nidus problem. It's the first problem that occurs. And for parents to look at their babies and say, oh my God, there's something wrong with my baby, it's super hard because babies are adorable. There's a purpose for their adorability in the world, and that is to help them get the care that they need. I remember my mother-in-law talking about my husband's sister and how she had the most irritating cry she had ever heard in her life. And she attributed it to the baby having been born very close to a sibling. So I think they're like 13 months apart or something. In those days, the Catholics, that's how we did it. And so they were very close in age, and it would have been very easy to ignore that baby. And she had a very, very irritating cry. And so you can see that there's adaptabilities in humans to get the care that they need. And it really makes it hard to believe that there's something wrong with your baby. It's just really, really hard, especially because it's behind the lips, right? Who looks in there? Nobody. There's a tongue. Check. Next, 5 fingers on each hand, 5 toes on each foot, and nobody thinks further along. But what goes on behind here is really, really critical in infancy. Breastfeeding is problematic. Don't want to say it that way. Breastfeeding is not problematic. They, the great and powerful they, make it problematic because they have something to sell. I did an assessment on a 20-year-old young man on the other day, and his mother was in the appointment with us, and she goes, "Yeah, it was me. I couldn't nurse. It was me. My nipples were flat." And I said, "They lied to you. Your nipples were not the problem. Your baby had a tongue tie. That was the problem, and it was unrecognized." When I finally did the assessment on this kid's palate, it was the most narrow palate I've seen in the last 6 weeks. It was extremely narrow. He'd already had braces twice. No one looked at his palate or the shape of his palate or the way that the teeth were in the upper arch. They were all kind of just pushed forward to give him enough room to be straight, which is better than pushing him backwards. But it still did not do anything for his airway. And his tongue then was interfering with his ability to breathe and to function optimally. And by 20, he was already symptomatic with other things. So they blame a lot on his fall where he had broken a tooth, and that's why he needed this problem and that problem fixed. And I'm like, the first problem is the tongue. Now, what we're seeing now, and I have collaboration with some of the other long-term, like over 20-year practitioners in myofunctional therapy, is that they are seeing more, I don't know, want to say damage. They're seeing more problems, these kinds of problems in more and more patients. So this is not a not real thing. So when the tongue is restricted in the middle, so we're getting away from the term posterior tongue tie and calling it a mid-tongue restriction, a mid-tongue restriction. So it's in the middle. Not at the very back. So there is an actual anatomical posterior tongue, which is behind the big circular taste buds that we have back here. So it's the part of the tongue that goes down the airway. So that gets interfered with. And so it would have been nearly impossible to release that tie in an infant. I don't know how they would do it. But today we have to find him a tongue tie release specialist that will go back that far, and he may have to travel to Chicago or to Los Angeles to have it done correctly and to go back far enough. So those are going to be my recommendations for that patient. So this is where we're at in the kissing spot saga. And excuse me, my rattle is starting to come up here. And this is where you can get the book now. I do have actual physical copies, and you can get it at primalair.com/kissing-spot. And if I didn't put it in the directions or whatever, I'm so annoyed when people like click here for this, click there for that, and there's nothing there to click. So I'm going to just go back down into the course description or the video description and add that link. Because sometimes when I type it in directly like that, it doesn't go to the right page. So there you go. This is Shirley Gutkowski signing off from St. Louis, where I'm going to be going downstairs in another couple of minutes to take in the last day of the exceptional sleep conference.